cannabis, also known as ganja, nyandi or weed, is the most commonly used illegal drug in Australia. In a recent Aboriginal and Torres Strait Islander health survey, 1 in 4 people has used cannabis in the last month. Like other forms of substance use, the harmful use of cannabis needs to be understood within the social and historical context of colonisation. Higher rates of cannabis use have been reported in some remote communities, and more males tend to use cannabis than females. Addressing cannabis use in communities is not always seen as a high priority, but anyone can experience harm from cannabis use. People more vulnerable to risky cannabis use include young people, people experiencing mental illness, or high levels of psychological distress, people in prison, and those who use alcohol and other drugs. Over the last 2 decades, the type of cannabis that has been cultivated has become much more potent or stronger in its effects. At the same time, there's a perception that cannabis use is more acceptable in the community. High potency cannabis and using cannabis frequently or at a young age is associated with an increased risk of harms. These harms include an increased risk of cancer, damage to the heart, and damage to the respiratory system, especially when use of cannabis is combined with tobacco. Smoking cannabis can expose a person to more tar and certain harmful chemicals than smoking tobacco. Harms to mental health include an increased risk of psychotic episodes, suicide, anxiety, depression, and problems with memory and paying attention. Aboriginal and Torres Strait Islander people are 5 times more likely to be hospitalised for cannabis-related mental and behavioural disorders than non-Indigenous people. There are many reasons to quit cannabis use or not use in the first place, such as to protect one's mental health, to protect respiratory health, for family well-being, and to save money. Helping people never start or quit cannabis use can make big improvements to their health and well-being. Given the early age of first use for a significant proportion of young people, it's important we let our young people know about the potential harms that may lead to long-term social and mental health problems. Programs to reduce cannabis use, they need to be culturally safe, planned with elders, and alcohol and other drug health workers. There is help available for anyone who is having difficulties with the effects of cannabis use. Contact your local alcohol and other drug counselling service, Aboriginal Medical Service, or see your Aboriginal Community Control Health Service for treatment and support.